Hi, this is Dr. Tess, and we're dealing with another edition of Tess Talk. In the next few weeks, we're going to be dealing with a lot of subjects having to do with weight management. I am board certified in obesity medicine, so we do a lot of weight management here. But let's talk about the basics. What we can begin with is the fact that there is one minority in this country that it is perfectly legal to discriminate against, and that is overweight people. It all fits into something called fat shaming, where people are made to feel guilty if they happen to be overweight. The belief out there, which is totally wrong, is that all you have to do is eat less and move more. Doctors will sometimes not give you any kind of medication to help with weight management because they say the only thing that's going to help you lose weight is pushing yourself away from the table. The belief that people who have weight problems are responsible themselves for this illness is very prevalent in society. And what people don't realize is the metabolism has a whole lot to do with your ability to gain or lose weight. Did you know that 25% of doctors do not spend time, actually probably more than 25%, do not spend time with overweight people? They cut the visit short. If they're dealing with your diabetes, your heart disease, your high blood pressure, they tell you, well, if you lose weight, that'll take care of all of it. Not facing up to the fact that there are a lot of different factors that go into high blood pressure and heart disease. And weight is only one of those factors. Weight is not an indication that you are not exercising. Very often, people who are overweight are exercising out there with the best of them, and nothing's happening. And then the favorite line of everybody, cut your calories. Cutting calories is the worst thing you can do for losing weight. Because basically, if you cut down the amount that you eat, your basal metabolic rate is how many calories you burn just existing. I mean, not even calories that you burn sitting upright. It's what your body needs to do to keep functioning. And everybody thinks that if you eat less calories than your basal metabolic rate, then you're going to lose weight. And they're right. At first, you start losing weight, but then you start losing weight slower, and then you plateau and you stop losing weight, and that's in about 6 weeks that happens. You plateau, stop losing weight, and in many instances on the same caloric content you start going up and gaining weight again. And the problem is, once you go back to your normal diet, your basal metabolic rate still stays low. You've heard of the show Biggest Loser, where these people drop all this weight by killing themselves with exercise and going on these incredibly low calorie diets. But 5 years after they've finished, or 6 years even, after they have won their prize, their metabolic rate is still down low where it went. So I am totally opposed to reduced calories as a way to lose weight. So in the next few weeks, we're going to be addressing all of these subjects and other ones in more detail. If you have any questions, please send them in and we will try to address those also, especially if they fit in with a particular subject that we're talking about.